Ever wondered what it really takes to keep a French Bulldog healthy from those adorable puppy days all the way into their senior years? You are not alone, and that is exactly what we're diving into on today's episode. But before we get into this, I would love to share a little update with you. At Tails and Tones, we are on a mission to help modern pet parents simplify everyday care and elevate life with our dogs without having to sacrifice style or sustainability. That's why we actually created the Tails and Tones podcast, which is a space where we share expert insights, real life stories, and thoughtful conversations that make dog parenting feel a little easier and a lot more connected. I'm so excited to share with you that we have just announced our very first product. So it is an elevated food and water system that is designed to actually support a healthier, more comfortable meal times for our pups. And we are working closely with many of our listeners who have already joined our waiting list and experts who are gathering real feedback and really shaping this product together. So it truly solves the challenges that dog parents actually face every day. If you would like to be part of bringing this feeding system to life, you can also join our waiting list, the easiest way to stay connected and also to help really influence what we are building. So just head on over to the link on our Instagram bio at Tails and Tones, or check out the link in our show notes to join our founding pack. You will help to really shape the design of this, but there is also some amazing goodies in it for you. We will have some people of this group actually test our products, and you will also get early access. You are going to enjoy that founding pack discount that we're going to offer. So a lot of good reasons to actually join and really shape the product that is not just designed to fill, a void, but it is actually designed by pet parents for pet parents. Alrighty, let's dig into today's episode. Hi there and welcome to Tails and Tones. I'm your host, Mariska Nell, also known as Piper's mom. Today, we are welcoming back the incredible Dr. Sarah Ramsey from episode 15, who you might remember, helping us put together our emergency kits. So she is an advanced veterinary practitioner with years of experience in small animal medicine, pain management, and holistic care. She practiced all over the UK and now calls the UAE home, where she has co-founded Dr. Well, and somehow manages to juggle vet life, rescuing animals, family life, and running ultramarathons. So we are super grateful to have you back on the podcast. Please give a awesome welcome to today's guest, Dr. Sarah Ramsey.
Thank you very much for having me again.
You're most welcome. So for those people that might not have listened to episode 15, where we talked all about our emergency kits, can you tell our listeners a little bit more about yourself and introduce yourself?
So my name is Dr. Sarah Ramsey. I'm an advanced vet practitioner in small animal medicine. So I kind of like all the cases most other vets don't like, so the really complex medicine things. I also do a lot of soft tissue surgery and things as well. I'm co-owner of Dr. Well Veterinary Clinic on Al Wasl Road in Dubai. We moved here 4.5 years ago. And yeah, I'm outside of veterinary medicine. I'm a keen runner, a mum of two, a collector of waifs and strays of various types. That's the problem with this job. I also do took up aerial gymnastics a couple of years ago for part of a midlife crisis. So that's my non-veterinary fact today.
Oh, I love that. That's amazing. And obviously today we are talking all things Frenchies, and they are such a incredibly popular but also very controversial breed. Why do you think they've actually exploded in popularity in the last couple of years?
Yeah, it was really around COVID times that it suddenly became incredibly popular, and in the UK became one of the most popular sort of breeds. I think sort of partly sometimes it goes in sort of like fashion. So if a celebrity has one, and I think in the time of social media, a lot of dogs have their own Instagram accounts. Again, the reason why they are so popular is they do have lovely personalities. They do look very cute. So they've been used quite a lot in advertising, in films and things like that, which again increases their popularity. And that is why there's also actually quite a big drive with the British Veterinary Association for breed to breathe, and actually to sort of speak to companies about not using them in their advertising, to not try to encourage more and more sort of ownership, unless people really understand sort of the problems that this breed can have, and how sort of what their care needs to look like, really, which obviously we're going to delve into today.
Yeah, oh wow. And so before someone actually brings in that French puppy into their home, what should they realistically understand about this breed, like from a medical point of view?
So I love Frenchies. I'm not here on this podcast today to sort of say, you shouldn't have a Frenchie. But I think, people need to be really realistic that, you have to, either have pet insurance or, quite a large savings bank, because unfortunately you are very likely to be spending, quite a lot of time at the clinic. I cannot think of one patient that only comes once a year for their booster, sadly. And that goes for other breeds and things as well. Not sort of sectioning the Frenchies out, but they are probably, unfortunately, one of those breeds that I could list lots and lots of things. So the first thing, if somebody sort of speaks to me about thinking about getting a Frenchie puppy, I would sort of say do your research as to where you're going to get them from. Obviously, we have unfortunately no reputable breeders here in the UAE, but there are more reputable breeders in the UK. And again, there's big drives with the Royal Veterinary College, grading these dogs on BOAS, and obviously trying to selectively breed dogs that have better conformation, and less health risks. So really doing your research and meeting the sire and the dam and seeing how they breathe, how they move, what their skin is like, can be a big thing. Sort of secondary to that, obviously, again, unfortunately, there are lots of Frenchies here that are in rescue centres, and it's wonderful when people, decide to rescue and give a dog a second chance. But again, it's finding out what problems does that dog already have, and then knowing what other problems we might be encountering. So unfortunately, one of the biggest things is their breathing. With being a short-nosed dog and being here in the UAE, they are 3 times more likely to get heat stroke. So having BOAS surgery is very important. Secondly, skin. We're much more prone to allergies. So that's environmental allergies, food allergies, because of the folds. We'll get dermatitis in the folds. We'll get interdigital cysts. We're much more likely to get Demodex. So skin is the next thing on the list. Eye problems, because we have our little squishy faces and our pokey outy eyes. We're much more likely, unfortunately, to get trauma and ulcers, and those ulcers take a lot longer to heal than in other dogs because we don't have the best tear film. We're much more likely to get things like mast cell tumours, so a type of cutaneous skin cancer. So all lumps and bumps should be very quickly checked in these dogs. Then moving on to the musculoskeletal system, unfortunately, to make that little skewy, little cute, little funky tail at the end, that is a mutation of the vertebra, and so we'll often have those hemivertebrae along the spine as well. And obviously, that your spine shouldn't look like that. Your spine should be a nice, healthy spine. And if we have these abnormal vertebrae, that can mean that we're much more likely to get bulging discs, and that can just be something from having a painful back to actually being paralysed and requiring surgery. And those operations and things like that, are very, very costly. We're also more prone to having cruciate ruptures and luxating patellas in the knees as well. So those are probably going from the tip end. We're also quite sensitive tummies. I missed that bit out in the middle.
Wow.
So often we can have food allergies or food intolerances, or if we pick up things like giardia or coccidia or something, we're much more likely to have ongoing issues with our tummies going forward.
Oh, wow. So there is definitely a lot of those issues. And like someone, when they actually look at the parents, when they kind of looking for these puppies, those are crucial things to kind of, obviously you might not know, oh, does this dog actually have a crooked spine, without going and feeling and testing, and
Yeah.
and I feel that's also one of the key tells that, if a breeder does not want you to see the parents, or they don't want to meet you where they actually breed these dogs, then that's kind of red flags.
Massive red flags. And yeah, you again, it was like, oh, they said they were so nice. They said, it's such a long drive for you, we'll meet you at this service station.
Yeah.
They don't want to see where you're keeping those dogs. You do not get a dog from that place.
Oh.
And it's the same as like, oh, mum doesn't like it when you come to see the puppies. Right. If mum has behaviour like that, those puppies are going to have behaviour like that. But often that's because mum isn't there, because these are puppy farm puppies that have just been taken away from mum and are just sitting in a cage somewhere. So yeah, if you're being asked things like that, those are massive, massive red flags. Walk away and report those people to the local authorities for an inspection.
Yeah. That's good. I think we definitely need that, because there's a lot of breeders that should not breed with these puppies. And I mean, so now we've got this cute little puppy at home. Hopefully we've actually rescued one and we didn't support some of those breeders. But anyway, if we've got this French Bulldog puppy at home, what does that early care look like for them? What is the best we can do for them?
Okay, so first thing is sort of getting all of that information from the breeder or the rescue centre. So knowing exactly what we've been vaccinated against, what preventative healthcare we've had, what diet are we on. Now, I always say to people, do not change anything in those first 2 weeks. We need a settling in period. So if we're changing loads of things, we're going to have a bit of a disaster. And all change should be really gradual. So do nothing for those first 2 weeks and let them settle in. Then say we don't like the diet that they've come from the breeder or the rescue centre. You want to slowly change that, but just make sure that it is breed appropriate and age appropriate as well. So again, do your research. There is so much information out there, and a lot of it from people who are not qualified. So just making sure that it is balanced and got everything in it that puppy needs is really, really important to having a really healthy puppy. And again, we don't want to, sort of over vaccinate or give medicines when we don't need it, but just making sure that we've had all of the primary sort of vaccinations, getting a vaccine check to make sure we've got an adequate vaccine titer. Maybe if you're not wanting to particularly do another worming sort of treatment or something, take a stool sample to the vet. Let's get an imagist done and have a look and see if we've got any oocysts or, parasite eggs there that requires, sort of further treatment. And again, welcoming any dog into a new home, there's sort of like, we have this sort of 3-3-3. So 3 days to kind of adjust, decompress. Sorry, 3 days to decompress, 3 days to adjust, and 3 months to sort of really kind of settle in. Again, getting, if it's your first dog, or even if it's not your first dog, I mean, I've had dogs my whole life. We've rescued a younger dog this year, and I engaged with 2 brilliant trainers here in the UAE to help me, because he's a totally different energy to any other dog I've ever had, and Frenchies are definitely up there in the high energy stakes.
Yeah.
So getting them well socialized, once they're ready to go out, engaging with those trainers to really help that dog fit in with your lifestyle and your home as well is really important.
And I feel one of the things that we kind of really didn't know how bad it could be was pneumonia. And so we were fortunate enough when we were in Australia to actually have access to a web vet that we could call 24/7, which we did most of the time. And, so one of the things is she was kind of listening over the phone to Piper's breathing, and she was just like, how fast can you get to the emergency room right now? And yeah, so take us through, what are those earlier signs? Like, obviously, they do struggle with breathing, but when does it go from struggle to breathing to rush there?
And I think that's the problem, is that we think that is normal. That's not normal. Like, that is not normal. So, when I can hear a patient before they come in the consulting room, that's a problem. And, often once these dogs have had BOAS surgery, they don't breathe like that. So again, you should be sort of knowing what is normal for your dog. So when they are resting and sleeping, that is the time to count your resting respiration rates and look at the effort to the breathing as well. So, and the mucous membrane colour. So all your different kind of colours of Frenchie will all have slightly different coloured sort of gums, but we're looking for the sort of non-pigmented areas, and they should be a nice salmon pink. And the tongue should be a nice pink colour as well. So when that is looking blue and purpley, and when those things, and when we're really opening our mouths really, really wide, and we're really gasping, and there's lots of abdominal effort, that is bad. And obviously that can happen for a very short period when we've been racing around and being absolutely crazy, but it should settle really quickly as well. So within a minute, that breathing should be sort of settling. And if it is not, then that is an emergency. There shouldn't be no effort to this breathing. We should be breathing from our chest, not from our tummies. There shouldn't be, huge sucking in of air. Dogs will often sit in slightly funny positions, so they'll put their legs out, neck will go up to try to get air in as much as possible. If you imagine after you're running and we sort of bend over and kind of go, that's the doggy equivalent of that. So again, if we're sort of sitting in funny positions or we're extending our neck and things like that, that's again a sign that we're struggling.
Yeah. So, I mean, struggle, like even when I go and run, 20 kilometers, I might feel like, okay. But after a couple of minutes, it tends
settle
to go.
down.
Yeah. So we definitely need to look out for that. And you've just mentioned like BOAS. And I mean, I honestly feel like most Frenchies need it. And I see so many that I'm just like, is there even a hole in the nose? So kind of talk us through BOAS. Like, at what age do you kind of start assessing French Bulldogs for it? And what are some of the practical signs that, this dog definitely needs the surgery? And are there cases where you're like, I would definitely not recommend BOAS?
Yeah. So I don't think, unfortunately, I've met any French Bulldog that couldn't have had some level of BOAS surgery. Obviously, some are more sort of badly affected than others. And that's basically, and we use, BOAS is just Brachycephalic Obstructive Airway Syndrome. So that goes for all brachycephalic breeds of dogs, so your pugs, some cavaliers and things as well. So it's not just French Bulldogs that we do this on, but probably more than others because we see more Frenchies, sort of here. So it's a very common procedure, and it's including sort of shortening the soft palate, widening the nostrils. Sometimes there's extra tissue to remove as well. Some dogs will also need tonsillectomy, so removing of their tonsils or the laryngeal saccules too, depending on how big everything is in there. And often the earlier the surgery is done, the less likely they are to need those sort of secondary things, because we'll get lots of secondary changes the longer these dogs are sort of, struggling to breathe. So the benefits are that, we're going to improve the breathing. So if you imagine, when you're drinking a drink with a straw, and you're sucking really hard and you're collapsing that straw down, it's really, really hard to get the liquid up. And that's basically what these dogs are doing on a daily basis. Wow. So as well as us having them smush their faces so they don't have a nice long nose to warm the air up, we've made really tiny nostrils for them to breathe through, which is why they breathe through their mouths a lot of the time. And then they'll also have a much smaller windpipe than we would expect of a dog of their size. So they are most of the time functioning with lower oxygen than they really should be. Again, at one of the vet congresses, they provided masks for us to wear to move around in, to sort of mimic how it's like to be a brachycephalic dog. I'm quite a fit person. I used to do ultra marathons and things like that. I couldn't have this on for more than a few seconds. It was horrible, really horrible. And these dogs, because they're born like this, they cope very well. But that doesn't mean that they should be like that for their whole lives. So obviously, by improving that air quality and that flow, we improve their quality of life. They can play better, they can do more, they can sleep better. A lot of these dogs, don't sleep very well because they'll have sleep apnea, because they're hypoxic, and their bodies will be slightly waking them up the whole time to breathe better. It reduces other health complications. So early surgery, like I said, will prevent, things like reflux, regurgitation, laryngeal collapse. And the big thing here is that you're much less likely to have heat stroke. That's the sort of biggest thing. It's not a simple surgery, because we're obviously playing with the airway,
Yeah.
you definitely need to have a veterinary team that know how to anaesthetize and recover brachycephalic patients. Someone who does the surgery, sort of a lot. The recovery period is about 1 to 2 weeks. It's quite quick. The most sort of complex thing is in that sort of immediate sort of post-operative time period. You can get swelling and things like that, so we have a special ICU unit that we can control temperature in and oxygen flow to minimize sort of complications. We also pack the back of the throat as they're recovering to reduce sort of swelling. So it is unfortunately an operation that we do a lot at the clinic, and like I said, it can really sort of massively change how happy these dogs are. And definitely we'll have dogs that just struggle coming from the car into the clinic. They'll be really panting, and then after the BOAS surgery you're like, oh, I can't hear them. And I've had sort of one client after her dog, I think, was 10 when we operated on him, and she spent 10 years listening to him to snoring every night. And I think it was about a week until she could sleep properly, because she just couldn't sleep because she couldn't hear him snoring anymore.
Wow.
And that dog was like a puppy again, really.
Oh, wow. And so kind of at what age do we look at this? Because obviously, for me, when I would ever look at a French Bulldog puppy, I would be like, okay, let's just get it done. Is there time? Do we need to wait for them to kind of, because obviously their face is growing, everything's growing. So can you do it on like a 6-week-old puppy, or how old should they be?
No, we like them to sort of grow, because definitely I'll have puppies where I look at them and I go, oh my God, you have no face. So you're just kind of like, well, we're definitely going to be doing surgery. And actually, as they grow, it's maybe not as bad as we thought. They still need surgery, but it's maybe not going to be as extreme as we thought when they were really tiny. Obviously, some dogs are really struggling from a very, very young age. So maybe those dogs, we would be doing some form of surgery at an earlier, sort of stage. We tend to try to wait, until they are somewhere between 6 and 12 months of age, really, to do that when they're fully grown. And that will kind of depend on being male or female, and just sort of when they stop growing, really.
Okay. And then kind of talking about the male and female, obviously getting a dog neutered, whether it is spayed or desexed, what is that kind of perfect age for a French Bulldog? Obviously it might be different for male or female as well.
So I'll go and open up my little cupboard here, and I'll show you this lovely frontier, if I can try and get it off the, oh, excuse me, it's a bit dodgy. Oh, there we go. So this is the Frontier study. So this was a huge study that looked at 40 different breeds of dogs. So again, traditionally when I started practicing, it was always neuter every dog 3 months after their first season. And if it was female and male, probably about a year old. And that was sort of a blanket thing. Then pre-pubertal neutering became very popular, particularly with rescue centres, so that they would be neutered before they went to their homes. Now we have a lot more data at looking at different breeds of when we should be neutering. So if we look at French Bulldog sort of on here, male dogs should not be any earlier than 6 months of age, and again with the females. So for different breeds of dog, we have sort of all different sort of guidelines and things, and certain dogs that shouldn't be neutered at all, because the risks sort of outweigh the benefits. So again, it's normally a conversation I have with clients. So I would sort of say definitely not before kind of 6 months, depending on their behavior as well. If they are very nervous dogs, I would not be neutering them either. I'd be looking at a behavior program and trying to build their confidence, because particularly male dogs, if we, a lot of them will need their testosterone to make them brave. So if we're neutering them and taking that away, then we can cause further behavior issues. So again, sometimes we can use implants to sort of see, is your behavior going to get worse or better, sort of with that. But sort of it really needs to be a conversation looking at the whole patient. And again, so sometimes we might be thinking about doing it at 6 months if we've got really, really bad airway disease, or we might be saying, actually, let's wait more till sort of 9 to 12 months, or kind of 3 months after that first season, particularly if we have a female dog with a very infantile vulva. So that's a vulva that sits really far back, because again that can increase their risk of UTIs and things, because it pops out once we have our first kind of
Oh,
season in a
because
lot of
that's the
females.
issue with Piper.
Yeah,
Like that's one of her things, and we like had to do it at a certain time
yeah,
because that was our
because
contract with the
yeah,
rescue. So I mean, all of those things kind of play into
yeah,
perspective, but I definitely think that's
absolutely.
worth having the conversation with your vet
Definitely. And
also.
again, some people, just their lifestyle and things like that, it's impossible for them to deal with a female dog on heat. And
Mm,
that's totally understandable. Again, in London, we tended to do a lot, just before 6 months of age, before they'd have a season, because, we had a large amount of dogs in a small area, lots of dog walkers, daycares being used, and it just was risky for
yeah,
those dogs, to have a season, because it was very likely they were going to be caught.
yeah.
So often, if you can keep them safe and keep them in, and some females will only be on heat for 5 days.
Okay.
Snow, when we rescued her, that was 4 weeks
Wow.
of lots of blood and mess, sort of in the house. So that can be hard for some people to deal with. But it's like I said, it's something that we have a conversation about, dependent on sort of breed, lifestyle risks, other things that are sort of going on,
Mm.
as well.
Oh, wow, that's very interesting. And I mean, when we look at like the body posture of a French Bulldog, they are very compact. They are heavy. I mean, Piper weighs almost 12 kilos. And I mean, it's not like she's overweight. So don't ever call my dog fat for anyone who sees me. I'll be very offended. But yeah, they are very compact. So, what can our us as owners actually do in those early stages to like set them up? Is there like ramps? Do we need to like certain games? Should we not teach them to play that? Because obviously you've got the neck and yeah.
Yeah, so definitely, I think all dogs should be trained as puppies to use a ramp in and out of the car, because jumping in and out the car is possibly one of the worst things that you can do. And then once they're older and have arthritis, then you're trying to train them to use this little rickety metal ramp or something, and they're like, "Oh my goodness, I don't want to go down that." Whereas we make it fun as a game when we're a puppy, when we're in that critical period of learning, then it's just an easy thing to do, and that's something that again that can fold up in the car, and it's just something you put out every time, and they learn to walk up and down it. So definitely ramps I really, really like. Ball throwing is a massive no for me for every single breed of dog. Those ball throwers, those sticks
Oh
like
yeah,
that,
yeah.
should be banned. They are so, so bad for your dog. Balls can be fetched, but it's best if the ball is not rolling, so the ball is still and then. But even then, I would suggest it is not a great thing to do and sort of play. Again, sort of tug toys where we're sort of pulling the dog around, things like that. Again, for these dogs with spinal issues and neck things are not a great idea, sort of either. Again, sort of really focusing on sort of core strength and keeping our legs strong. Learning sort of sit to stands, cavaletti exercises where we're stepping over poles. Water treadmill, sort of things like that, I think are super important. And again, sort of establishing an early, sort of pattern, it is good to then, sort of build on as they're older. When it comes to sort of, yeah, body condition, the best thing to use is the WSAVA sort of guidelines. I'll scoot backwards 1 second and show you this. So again, when we're looking at we'll kind of call them a medium dog. Some of them are medium, some of them are small. So you're basically looking sort of this. So it's not about numbers. We need numbers for drugs in veterinary medicine, is why we weigh them.
Mm.
But also you'll notice on veterinary notes there's a score out of 9. And sometimes I get people going, "Oh, you don't like her very much. You've only given her a 4 out of 9." And I'm like, "No, 4 is brilliant. You don't want a 9 out of 9, and 9 is bad."
Oh wow,
So
okay.
so when we're looking at that, so a 4 and 5 is ideal. So with this, you should have the ribs easily palpable with minimal fat covering. The waist should be easily noted when viewed from above, and an abdominal tuck is evident from the side. So you basically need to feel the top of the dog, the side of the dog, look at them from above and look at them from the side. You know, if we're looking at 9, there's massive fat deposits over the thorax, spine and base of the tail. The waist and abdominal tuck are absent, fat deposits on the neck and the limbs, and obvious abdominal distension.
Oh, wow.
So yeah, this is the time when you don't want full marks.
Yeah.
You want a 4 or 5. And similarly, we don't want a 2 or a 3. And I will see some Frenchies where we've got, you know, chronic enteropathy, so chronic gastrointestinal issues, where we are sitting at a 2 or 3, where we are too thin because we're not absorbing food properly and things as well. So so you know, definitely with these dogs, you know, I'm probably stricter on my French Bulldog owners than and my large breed owners as well, really. You know, any dog that's prone to spinal issues, you know, so dachshunds and everything like that as well, you know, or any dogs prone to osteoarthritis, will be wanting to try to sit as close to 4 as we can. You know, 5's okay. We definitely don't want to be sitting at 6 or above.
Awesome. So I think Piper might be a 5 or 4, 5.
She's perfect. She's really good. So that's exactly where we want. And again, we will also muscle condition score. So again, that's when you do want to try and score 3 out of 3, or just a 2 out of 3, and not a 1 out of 3. And again, you know, some of these dogs where we have got you know, spinal issues and we're not using we can't use our legs properly, our muscles will waste in our hind legs, so we will be scoring 1 out of 3 in those hind muscles.
And I mean, so one of the things that probably every French owner want to like avoid is that term IVDD. And it is a very common thing amongst French Bulldogs. Can you kind of talk us through exactly, firstly, what is IVDD and what are some of those early signs that we can kind of pick up to make sure we give them the best opportunities?
So IVDD stands for intervertebral disc disease. So it kind of goes back to what we were talking about at the beginning. So again, some of these dogs will have little hemivertebra. So instead of a normal spine, we've got abnormal vertebra sitting there. And that makes the spine unstable. So obviously we've got our vertebral process. We have our little cushion, which is our disc, and our spinal cord running through all of that. And what happens, so sometimes, again, that can just be over time. You know, again, we know certain breeds are predisposed to having this problem. So I will have people who do everything I tell them to. So they will keep their dogs slim. They will do their exercises. They won't let them jump on and off the sofas. They don't let them run up and down the stairs. They don't let them jump in and out the car. And the back still goes. But often that tends to go at a much older age than at 2 or 3. Sometimes it can be traumatic. So sometimes it can be that we get, you know, clobbered by another dog and we move awkwardly and the disc explodes. So sort of it can be just a mild bulging of the disc that traps a nerve. So often those dogs will be very painful. So they might shiver, they might be hunched over. Sometimes a lot of people will think it is gut pain, and it's not, it's actually sort of back pain. It can progress from that to obviously if the spinal cord is very compromised, so if the disc really extrudes and compromises the spinal cord, it means that messages cannot go up and down the spinal cord to the legs and to the brain. So there's a disconnect there. So often it means that they will drag their hind legs, or sometimes they can't walk at all. They are completely paralyzed. And obviously that also affects other sort of things as well. So that will affect their ability to urinate and pass feces as well. So those are medical emergencies when you cannot, you know, when you're starting to get what we call proprioceptive deficits. So when we're not sure, you know, where our feet are. So we're either dragging them, or when we place them, you know, if you bend the foot over like that, the brain should go, my foot's facing the wrong way, I need to be like this. And so they'll immediately place it like that. But if they're just like, I have no idea, my foot's the wrong way, you know, or they're scuffing their feet, that shows you that those messages aren't going up and down in the way that they should do. And you need to seek emergency, you know, sort of treatment straight away. Now, sometimes that can be medically managed. So that's with anti-inflammatories, rest, you know, and very, very strict rest. But often we will need advanced imaging of the spine, so either CT or MRI, to see how compromised the spine is and whether surgery is needed and where. And that's obviously then where specialist surgeons will go in and do what's called a hemieliminectomy often, where they take out the disc material. Sometimes they will need to stabilize areas as well, depending on what has happened. And then, then there is physio and things after that for recovery. So often, these are expensive conditions because imaging is expensive, the surgery is expensive because it's very specialized. There's only a small number of vets that can do it. And then you have a long recovery. And again, if you're not, not able to put the time and effort into the recovery, you're not going to have a great outcome. And sometimes, those dogs still have compromises or cannot, still walk just because there's been so much damage, done to the spine that can't be repaired.
Yeah. Oh, wow. So would you then kind of recommend also with like the x-rays and the MRIs? Because I mean, we did an x-ray, but that was kind of part of Piper's previous surgeries, and we could see that she's got a crooked spine. But would you recommend for Frenchie owners to like do like, the x-rays or an MRI to just like give them a little bit more peace of mind? Or does that make it like if they do realize, oh my gosh, the discs are so close to each other, we might be facing IVDD? Like, yeah, there's like pros and cons, I feel, but.
Absolutely. I mean, I think the problem is that even if you kind of know the discs that you're sort of worried about, over time you can have more discs you need to worry about, so you're very likely to need that imaging again. I think if I had an asymptomatic patient, I probably sort of wouldn't. If I noted a very bad kyphosis, so a very bad sort of curving, or sort of lordosis or anything like that of the spine, then I probably would suggest kind of imaging. But probably more to sort of start a physio program, sort of earlier. So, definitely there are benefits to kind of knowing where our weaknesses are so that we can then avoid certain movements. Again, like I said, try to work with a physio to be able to, sort of strengthen our core, strengthen, sort of areas in the body to just try to keep this spine, sort of nice and stable. So that can be then something that we can work on. So there are definitely sort of, kind of benefits, but it's often, that doesn't mean that there won't be problems and you need to repeat that imaging again, and then that becomes quite an expensive
Exactly. And like kind of looking at the posture and things of Frenchies. So how important is like the feeding posture? So when they eat and drink, and is it beneficial for them to use an elevated food and like water setup?
Definitely. I think a lot of breeds, benefit from this. So again, by not having to bend, the sort of the head all the way down, I don't think we'd like to to kind of eat like this. So I'm not sure really why we expect our dogs to, you'll see obviously in the wild, if they caught something, they would lie down with it, and obviously again, you'll get some dogs that do that, and then we probably know that they are uncomfortable at bending down to a bowl. So elevated bowls are really, really nice. It's also great because, like we talked earlier, some of these dogs are prone to regurgitation.
Yeah.
So that elevated feeding is much nicer for them because it's easier for that food to get into the stomach and stay where it should be, rather than flying back up again. And again, when it flies back up, we're at risk from aspiration pneumonia, and we already know we're not very good with breathing stuff already. So there's many benefits, not just from a musculoskeletal point for Frenchies and certain other breeds. The elevated feeding can be really, really good.
Oh, that's great. And I mean, some of these French Bulldogs I've seen actually gets the little chairs as well after they've eaten, and then they have to like sit in this chair upright. So, for like 20 minutes or things. So there's definitely a lot. And that brings us back to like kind of, when you get this puppy, or when you want to consider getting this puppy, know what you're getting yourself into, because it's not necessarily that every French Bulldog's going to go through this. I mean, there might be some healthy ones, but it's more likely that you will face some of these issues.
Yeah, definitely, there, like I said, there are some that I see a lot more than others. I love them all. There's definitely some I would wish for them not to have to come and see me, sort of so much. And there's some that I think are obviously from very good stock, but often when you're looking at those dogs, yes, we'll have there's the conformation will be quite different, so we will have more of a nose, we won't have sort of quite so sort of sticky outy eyes, not so many wrinkles, sort of on the face. So often when those features that we as humans have decided are very attractive and we've over exaggerated them to look cute, unfortunately that's come at a cost, for the dog. So again, when you're picking out your puppy, or when you're at the rescue centre looking at that dog that needs a home, when you're looking at these exaggerated features, it's just to be mindful that actually that probably does mean that there is going to be more upkeep, sort of more, I'm sure your daily routine with Piper is quite intense with cleaning her face and her tail folds and stuff like that. So if you're used to having a dog, like my Bedlington Whippet, that there is very little upkeep. That's why she looks so scruffy, probably. But I don't need to do a big, sort of daily grooming routine, sort of with her at all. It's only really when she gets dirty that we need to sort of do that. But that's things to put into place that you've got to make sure that you have half an hour to an hour every day to be doing your exercises, and everything as well.
Yeah, because I feel also with the folds, so I mean, we clean it daily, like in the morning. It's like we wash the face, we clean the ears whenever she's in the stroller, because that's the only time I can actually get in there with a little tissue. But then again, like it's also about, sometimes under the chin, because obviously how she drinks water, it's like, I don't know if she wants to wash the floor, but everything gets wet. So like we use, and I can't remember the name. It's that pink stuff. You call it something that we spray.
Chippy scrub, yeah, chlorhexidine, yes.
Chlorhexidine. So we use that and we clean the folds like every other day with that. Not every day, but normally every day it's with water. So, like kind of just like looking at that, is there, you would say, like bathing the French Bulldogs? Do we want to keep that to a limit, or is like once a week and like too much?
Yeah, I mean, obviously with the face, yeah, we have to stay on top of that. And just like you said, we don't want to be using something like the hippie scrub every day. Sometimes there will be points where we maybe have a yeast overgrowth that we do. But yeah, sort of again, just making sure the folds are clean and dry is really important. And then, yeah, with every dog, really, we want to try to limit how often we bathe them, because it dries out the skin and then can make them prone to having sort of overgrowths of their normal skin flora as well. So again, that will vary from dog to dog. Most dogs I sort of say, once a month. Again, some will need to be bathed more than that. But obviously, the more you wash them, like I said, often they will smell more doggy. But it's a case of knowing your own dog and checking all of those bits. And definitely, it might not be the whole dog needs to be washed every week, but certain bits do. So it's just yeah, sort of keeping a watch and knowing sort of what they're like, really.
Yeah, so also like kind of when you go to the beach, would that mean we need to just rinse off with water? We don't have to do a full, shampoo, conditioner time of routine, or even like the feet, when that goes into like water, do we just quickly rinse that?
Yes, so definitely, when we've been in, sort of places where, yeah, so salt will dry the skin out. So just, but you don't need to sort of shampoo them, just rinsing off with water is fine. Again, when we've kind of been to the desert and we've got sand everywhere, again, some coats that's easy just to kind of brush off, but others that might be easier to get the shower head on them and sort of move things as well. Again, it's not so much of a problem here, but I used to do canicross with Snow, so she, I'd have to rinse mud off her every single day. And sometimes that would just be our feet, and sometimes it would be our entire body, depending on where we've been. So so again, that's and using something that's very mild, dog specific, something with something nice like aloe vera and oatmeal on it, so it's very nourishing to the skin, can be good as well.
Awesome. And like kind of when we go back to like the food for French Bulldogs, I mean, there's like so many things and you get like all of these nutritional, guidance or anything. But from your perspective, what you would recommend, what does like a healthy diet look like for a Frenchie?
Yeah, so again, I think again that is very personal to that dog. So that will depend on, do we have skin issues? Do we have tummy issues? Again, you're looking for something that is, sort of really balanced. Dry food gets a really bad rep. It shouldn't do. It is not the McDonald's. There are better dry foods than others. It's definitely the thing that will have the most transparent nutrition, sort of there. And when people say it's got fillers in it and things like that, no, every single thing is in that food because it will bring something for that dog, and a lot of micronutrients that are very important. Personally, mine are on, sort of a pre-cooked, sort of food. So it is a little bit more kind of natural, as some people would say. You can do home cooked, but definitely you need to consult with not just a nutritionist, because lots of people can call themselves nutritionists without any sort of qualifications, but actually speaking to somebody, and ideally a vet, who has got new sort of nutrition to formulate a nice balanced diet for that life stage and other clinical conditions that sort of dog has. Again, lots of people are very much into raw feeding. Again, you need to be very careful that it is fully balanced for that life stage. Sort of home feeding and raw feeding can be done very, very badly. Again, we need to make sure that cold chain is safe throughout, because again, when we feed food that we're not then sort of cooking, we do have an increased risk of Campylobacter and Salmonella. So we need to be very careful with washing bowls and the dog's face and things like that. I'm very much an advocate for feeding what works for your patient and your lifestyle and your ethics and things as well. So I never say no to anybody. The only time I'm a little bit concerned is if I have an immunocompromised person in a household. So if I have very, very young children or very old people or people who are undergoing chemotherapy with raw feeding, because I did have a patient contract Campylobacter from a raw fed dog, and we did trace it back to the food. Wow. We did a full investigation. So that I just tend to I'd never say no to people, but I just say just be very mindful. Sort of with that. So I'm very open to feeding, sort of anything, as long as it is balanced and you've done your research into knowing exactly what is in there and what works for that patient as well.
And then how many times a day do we feed them? Obviously, we have the number, like you don't, feed them 5 times a day, that exact number, but you kind of spread that. Like, how would you say, like, obviously it also differs from puppies. They might, eat more frequently. So how many times do we need to give them food? Piper would probably say every day, snacks.
Yeah. So again, there was a recent sort of study that I think has kind of sort of thrown people a little bit, and it was sort of saying that dogs fed once a day live longer than dogs that are fed twice a day. Mm-hmm. Now, what that study didn't look at was actually looking at body condition. So we often know that dogs that are fed once a day are probably a leaner body condition than dogs that are fed twice a day. Because when I will do a consult talking about food or a dog that is overweight and we're trying to lose weight, I know that I'm probably only being told 50 to 75% of what that dog is being fed. So even if I get people to list exactly what they're feeding, they will forget that actually while they were chopping something up, they gave something, or all the treats we did on our training walk, which is fine. Like, treats shouldn't be banned and treats are great for training, but it all becomes part of our calorific requirement. And particularly with small to medium breed dogs, just a little bit of something would be like me having a donut. So if I have an extra donut every day or 2 donuts every day, that's a lot more calories that I'm putting into my body. So we need to be quite mindful as to, sort of what we are, sort of what we're putting in and what we're putting out. So again, in the summer, it is very, very hard here and dangerous to be exercising for large amounts of time. Obviously, now it's getting cooler. We can do that, building up kind of slowly. We can go out more often. But again, I prefer personally that dogs are fed, smaller meals a couple of times a day. And definitely for Frenchies who are more likely to regurgitate and things like that, that does seem to work better for them. Often some dogs will have bilious reflux because, again, they're just sort of fed once and they're waiting kind of all that time for another sort of food, sort of meal to come. But again, like I said, it's very, very individual. Snowy, for the last 8 years, has only really wanted to eat once a day. She now we have the other dog who does have to eat twice a day, will take a little bit of something in the morning, and actually I would probably say that her gut is better for that.
Yeah.
So it's sort of seeing what works and experimenting a little bit. And definitely, yeah, puppies, because they've got such tiny little tummies and very high metabolism, will need lots of smaller, more frequent meals, and you can gradually move that to being 2 or 3 meals a day.
I love that. And also, like, kind of, with the Frenchies, like, how often do they need to come and see a vet? And, is there certain blood work that we need to do? Because I know you mentioned when they get to a certain age, we need to see
Yeah.
it twice.
Yes. I mean, it's always nice to have a baseline. So I much prefer to take blood when a dog is well and have something that I can compare to going forward. Because often when we see a dog and they're unwell and they might have normal bloods, like everything's in the normal range, but actually for them, their normal sits all the way over here. So I'm not getting any warning signs of early kidney or liver issues because that's the first blood I've taken. So that's often why we recommend, if they're coming in for neutering or an annual health check, is having some blood work done, and then you've got things to compare to. Definitely once we hit the age of 6 or 7, I advise for all patients twice yearly checkups and at least yearly bloods if they haven't been having yearly bloods, or twice yearly bloods, because this is when we'll often start to see issues and things appearing. So again, we can sort of track trends and pick up things much quicker, because it's always better to be proactive rather than reactive.
Yeah. Awesome. And for anyone that cannot come to you and, have them examine their Frenchies from their nose to their tail, is there like certain checklist items that you can say, like, this is what you need to get your vet to at least check, because I feel some vets, they work as a work, and, they try to see as many patients as possible, and like they might not be checking for something specific. So is there a checklist that we can give our listeners that they can go, this is the checklist, check these things?
Yeah, I think, it's a bit like, I really feel for human GPs. I think in the UK you have like 7 minutes to take a history, examine the human and sort out a treatment plan. I mean, we're very lucky. Most veterinary practices will have 15, 20 or sometimes 30 minutes. We at the clinic here always try to have 30-minute appointments for annual checkovers and boosters, because, I really want to literally check everything from here to here. And that's what an annual check should do, is that, your vet should be really talking you through from the tip of the nose to the tip of the tail. You've seen how I examine sort of Piper. I talk through all my exams. So I'll talk about, I'll open the mouth, I'll check the teeth. And, again, that's something that every exam, should be looking at, an ophthalmic examination, looking inside the ears, listening to the heart and the lungs, observing that patient. So again, if that Frenchie's been sitting out waiting to see you for maybe 10 minutes and we're still panting really badly, is that anxiety, or do we have a serious, breathing issue and things as well? So again, they should be asking you, do we breathe like this all the time at home? What's your exercise regimen like? How long can he or she manage to walk? Does she struggle to play, for any period of time? So, it's, as well as examining the patient, is asking about your lifestyle and checking in with diet and, sort of stool consistency, frequency of urination, accidents in the house, and then, feeling the tummy, feeling all the joints and the spine, looking at that body condition, and things as well. So it really should, you should have gone away from that consult kind of knowing that everything is fine. And even if some vets don't do like me and talk you through it all, they will type that in their notes. So again, you can ask for a copy of that and can sort of see that everything has been looked at and things too. But it's really knowing what is normal for your dog. So I always teach people with their puppies or their new rescues to look at everything. So do like a clinical exam like I do, sort of at least once a week. So you're kind of knowing what is normal for your dog. So you'll pick up on those changes early and be able to say to us, well, actually this skin is a bit redder than it usually is, or I found this bump here. Also, it means that if they're used to you touching all these areas, they're not going to be sort of as worried when we're touching all these things as well. So it just makes that examination easier. And obviously when things are painful and sore, it's not nice for them to be touched and looked at. And again, if they've had a bad experience and it has been sort of painful or sore for an area to be touched, then often we don't, they don't want that sort of touched again. So again, if you practice doing that at home and build their confidence that every time an ear is touched, it's not painful, then they're going to trust the vet to do that as well.
Exactly. And I mean, we've been trying to do our best with Piper, and even when we went to see you, that's the first time that we really noticed, or that you mentioned, oh, she's got a little bit of a shoulder issue, she's got back pain. And like, we were like, even when I have back pain, that is so sore. And I was like feeling, in a way bad, because I don't know how long she's been having this. And now we're kind of treating it with physio or something. But what are those subtle signs that owners can actually look out for, like, for discomfort or any pain that we often miss? Because, I mean, we didn't know.
and that's the reason why we love Frenchies. They're bold, strong little characters. So that they are so used to sort of just kind of cracking on with it and just getting on with it. And oh, we're going for a walk, brilliant, yes, great, doesn't really matter that my back's sore because we're just we're heading out. So it's why I love them. It's why they're actually very frustrating patients, because they often will give very subtle signs to us as well. So often that's a case of observing them. She normally climbs differently into that bed, or she normally moves around in a certain way. So again, it's sort of knowing what is normal, and then sort of looking for those very sort of subtle signs that maybe there's a bit of a hesitation to go down the steps, or she's moving up the stairs slower than we were before. And again, it's sort of doing that sort of nose to tail every day. It's just like, oh, did we kind of lick our lips, or did we sort of look slightly when I did that? And sometimes it really is as subtle as that you're looking for. And sort of feeling for sort of tighter areas in the body. We all know what it's like when we have a massage and on our back and things, and that person doesn't have to press very hard for you to kind of go, oh, and so again, sort of knowing what they normally feel like when you're touching them, again, will help you realize where those sore bits are.
Yeah. Oh, wow. And I mean, she's totally a different dog now. Honestly, she's running like crazy. She's doing
Brilliant.
2 like zoomy spins in the evenings. And yeah, and we've added the joint supplement as well. So things like that really, made such a massive difference. What is one thing that you want them to take away from our conversation today?
Is research. So, spend some time, foster, so really see what that sort of upkeep and things sort of look like, speak to other Frenchie owners, find out maybe exactly how much their yearly veterinary bill has been. I remember sitting on a tube in London and listening to a lady chatting on to a friend that she'd bought a Frenchie puppy, and that it had cost her £3,000. And her friend sort of said, oh, how much is the insurance costing each month? She said, oh no, I can't afford that.
Oh, wow.
And and my heart kind of just sort of sunk, because I was just like, okay, it's not just that initial investment. You have got food, you've got your vet bills, you've got your unexpected vet bills, sort of on top of that. And particularly with these, unfortunately, these patients who are prone to all these problems, you really have to consider before getting a pet, can I financially as well as emotionally and physically meet all the needs of this dog, because it's a huge undertaking. So it's something that like I said, I love them as a breed. I'm very upset what we have done as humans to them. I'm hoping that maybe there will be more of a drive to more ethically breed them. Definitely some countries have banned them now, which is quite a bold step, but that is really trying to improve these animals welfare, going forward, because we shouldn't be subjecting these animals to a lifetime of pain and discomfort. And I know owners who do it as much as they possibly can, but we really should be trying to fix it from the root cause. Like I said, it's all about being proactive, not reactive.
Yeah. And for anyone that currently has a Frenchie, so all of our Frenchie owners, is there one change that they could maybe make this week that could have the biggest impact on their dog's health?
Definitely looking at that body condition score. Okay, so get the WSAVA body condition score, put that into Google, and body condition score your own dog. If that dog is overweight, start on a diet to get that. And I think probably just sort of checking, when did I last have a really good nose to tail sort of health check, and just making sure that all of those body systems have been checked, and whether there's very subtle changes that you can make, like you said, like a joint supplement, looking at the diet a little bit differently, starting some exercises to strengthen our core, just to see if that can improve our quality of life.
I love that. That's amazing. And then just coming from like the breeding where you said, that is a thing. If there's anyone, because obviously they are in very high demand, and, like when it comes to ethical breeding, are there any like genetic testing that needs to be done, or are there any health concerns that when you see one of these Frenchies and you're like, do never breed with this dog, like kind of what are some of these things? Because I think a lot of people think, I'm going to get a Frenchie, we're going to get puppies, we're going to buy the new car, we're going to do this.
Yeah, I mean, I think sort of places in the UK, sort of like the Kennel Club, will have breeders that are registered on there, and it's about asking questions. So again, if you're sort of like, has mum and dad been BOAS scored, have they had surgery, any other sort of pre-existing kind of issues going on, what health testing have they done, and if you're coming up blank with a lot of those answers, then that's something that I would turn and walk away from. Again, just when you're looking at mum and dad, look at the conformation. Are we really exaggerated? Do we have really bowed legs? Do we have a really, really flat face? We should be, and that's what people love, is that flat face, but we should be having a nose. Like, do we have a nose? Do we have nares? Sort of, what is that temperament and behavior like of that dog? So it's obviously it's hard once you go and see a litter of puppies. It's very easy to fall in love with the first one that you see, but I do think a lot of people put more thought into purchasing a car or a house than they do with bringing a living being into their family. So this should be something that you do 3 to 6 months research on, not just 10-minute Google search and, I found some puppies, let's go and have a look at them and pay a deposit. So I think it's really, really looking sort of that, and asking all the right questions. There are some people who are working really, really hard behind the scenes to try to improve these dogs, but and it's getting a feel for that person. At the end of the day, they are making money from doing this, so it is a business for a lot of people. There is a very small minority where it is more of a hobby, and because they love the breed and they want to make the breed better. So I think look at the breed to breathe guidelines. The British Veterinary Association has some great things on their website, so looking at that, and asking your own vet, and speaking to other dog owners is a great start as well.
I love that. That's amazing. And Sarah, where can people find you in person and online?
Yeah, so we are at Dr. Well Veterinary Clinic. It's on the Al Wassel Road in Sakim too. We have our second birthday party this weekend, which Piper and yourselves are coming along to. So yeah, we'd love to see as many people as possible and have a tour around the clinic and get to meet the team.
Awesome. Well, thank you so much for being such an amazing guest. We can probably go on for hours to talk about some other health issues, but I think we did cover the main one. So is there anything else that you felt we've missed about Frenchies that we need to add in here?
No, I think we've kind of. I feel like I hope I haven't upset anybody, anybody today. Like I said, I do love them. I just think we could be better as people, to make their lives better.
Yeah, and I definitely think it is signing up for, even us, we didn't realize what we were signing up to when we got Piper. So we learned the hard way, and yeah, it's definitely, you need to invest the time, the money, and if you don't have it, don't feel bad, but feel it's better to say no and opt for another breed than get that breed and you have to give it up for adoption and, you
Absolutely.
know, kind of pass that hot potato. So,
Yeah,
yeah.
and I think there was a recent study showing that the average life expectancy of French Bulldogs in the UK is 3 years of age now,
Oh,
which is that is just absolutely heartbreaking.
oh,
And that is partly because yeah, overbreeding and excessive genetic conformation that are causing a lot of issues, and people not being able to afford to have these things corrected or treated, or they're just so severe they are not treatable.
yeah.
So I think that is a really sad state of affairs, and that's all man-made, sadly.
Oh, yeah, that is terrible. Well, thank you so much for being on the podcast. So, what an incredible conversation today. I hope that this episode has actually given you a clearer, more compassionate understanding of what our French Bulldogs truly need. From choosing a healthy puppy to actually supporting them through their breathing issues, spinal care, nutrition, as well as everything in between. So these dogs honestly bring so much joy into our lives, and I cannot imagine my life without little Piper. And the more we learn, the better we can actually understand to show up for them. So, a huge thank you to our amazing guest, Dr. Sarah Ramsey, for sharing her expertise and helping us actually navigate the world of French Bulldogs health with confidence and clarity. Thank you so much for tuning in to today's episode of Tales and Tones. If today's episode spoke to you, please head on over and leave us a review on Podchaser. It really helps us a lot and for other pet parents to find our show. And also share it with a fellow pet parent. If you actually know anyone with a French Bulldog, please send this episode to them. If you know of someone that wants to get a French Bulldog, also please send this with them. And if you've got any questions or you just want to pop on over and say hi, I'm always around. You can find me on Instagram at Tails and Tones, where every tale tells a story and every tone speaks from the heart. See you in the next one.